Hello and welcome everyone. Today, we'll be delving into the complex and multifaceted world of cancer. We'll define it, discuss its causes, its different types, and the crucial steps of prevention and early detection. Cancer is a group of diseases characterized by uncontrolled growth and spread of abnormal cells. There are many types of cancer, and they can develop in virtually any organ or tissue in the body. The term cancer itself comes from the Greek word for crab, karkinos, used by the ancient physician Hippocrates to describe tumors that had veins or extensions from the main body, resembling the shape of a crab. Our bodies are comprised of trillions of cells, each with a specific function and life cycle. Cells grow, divide, and eventually die off to be replaced by new cells. This is a normal, healthy process. But imagine if our cells had a mind of their own and didn't follow the rules. What if they just kept growing and dividing, with no regard for normal function? That's essentially what happens in cancer. Each cell in our body has a tightly regulated life cycle. It is born, it performs its function, and then it dies to make way for new cells. But in cancer, this process becomes disrupted. The cells grow uncontrollably and don't die when they should. This results in a mass of cells, which we call a tumor. Not all tumors are cancerous. Benign tumors are growths of abnormal cells that stay confined to their original location. They can cause problems, but they don't spread to other parts of the body. Malignant tumors, however, have the ability to invade nearby tissues and spread through the bloodstream or lymphatic system. This process is called metastasis. Metastasis is a complex process that allows cancer cells to spread from the primary tumor to distant parts of the body. This happens through a series of steps: local invasion, intravasation, survival in the bloodstream, extravasation, and colonization. Let's break down these steps. Cancer cells first invade local tissues, then they intravasate, or move into the bloodstream or lymphatic system. Once there, they must survive the journey to other parts of the body. If they manage to survive, they then extravasate, or exit the bloodstream, and begin to invade and grow in other tissues. This is how a cancer that starts in one part of the body can end up affecting an entirely different part of the body. There are over 100 different types of cancer, and they are usually named for the organ or type of cell in which they start. For instance, lung cancer starts in the cells of the lungs, and leukemia starts in the cells of the bone marrow which produce blood cells. There are many risk factors that can increase the chances of developing cancer, including age, family history, exposure to certain chemicals and substances, and certain behaviors such as tobacco and alcohol use, poor diet, lack of physical activity, and exposure to sunlight and some types of infections. However, having a risk factor does not mean that one will get the disease. Some people with one or more risk factors never develop the disease, while others develop disease and have no known risk factors. Many cancers can be prevented or found early when they are most treatable. Prevention strategies include leading a healthy lifestyle, getting regular screenings and immunizations, and avoiding risk factors when possible. Early detection methods such as regular screenings and self-examinations can help find cancer before symptoms appear. The type of screening test depends on the type of cancer and one's risk factors. Once cancer has been diagnosed, treatment options are determined based on the type and stage of the cancer, as well as the patient's overall health. Common treatments include surgery, radiation therapy, chemotherapy, immunotherapy, targeted therapy, hormone therapy, stem cell transplant, and precision medicine. These can be used alone or in combination depending on the specifics of each case. Research into the biology of cancer, its causes, how to prevent it, and how to improve treatments is ongoing. Scientists are constantly learning more about what happens inside cells that leads to cancer. This knowledge is leading to new and improved treatments, as well as better ways to prevent and detect cancer. That wraps up our discussion on cancer. It's a vast and complex topic, but we hope this video has helped to simplify it and has provided you with a clearer understanding of what cancer is, how it forms and spreads, and what can be done to prevent and treat it. Thanks for joining us, and until next time, take care.